Hello everyone, this is Dr. Imran Deshmukh from India, and today we'll be speaking about a lens called as the AUTOFOCUS Pro. This lens is a progressive lens just like our progressive glasses which we use daily. So this lens does not have any rings like our conventional multifocal lenses. As you can see, this lens is a quite big lens. The haptics are quite large, saw-shaped haptics. These haptics are made in such a way that they provide good stability in the bag. Carefully place the lens in the cartridge. Make sure that this lens does not get stuck because these lenses are big lenses. So once you have done it, slowly push the lens to make sure that the lens is free in the cartridge. Take this cartridge, insert it in the main wound a little inside the AC and slowly push. You have to be slow and steady. Make sure that the AC is filled with visco. So when you're pushing the lens, you can see the haptic coming out. This haptic is going directly into the bag. Be slow and steady. So once the lens is inside the anterior chamber, you can use a T-pusher to push the trailing haptic inside the bag. So now be slow. Now once it's inside the bag, what I usually use is an IA probe. I usually go behind the lens first to take out all the visco. Over here you can see that there are holes in the superior side of the optic. There are two holes. Both of these holes are supposed to be placed superiorly in 0 to 180 degree axis. I'm removing the visco behind the lens and now in front of the lens. These lenses provide very good near and distant vision. And they say about this lens that put the lens, dial the lens and leave the lens. So you can see I'm placing it in 0 to 180 degree axis, and this is a superior incision and I prefer sitting superiorly for all of my phaco cases. So now once all the phaco is out and the lens is placed in 0 to 180 degree axis, so I'm removing all the visco present in the AC. And before removing the IA probe, what I usually do in all of my toric cases is I hydrate the side port before removing the IA probe. Why? Because the AC collapse will cause a rotation in the IOL, so it's always better to hydrate. Now I'm hydrating the main wound, so you can see the lens is quite stable and quite fine. So I hope this video was helpful. Thank you for watching.